Let's start with the muscular system. Now, this time, unlike the bones, we're not going to start with muscle tissues first. We're going to dive right into the muscular system, and then next week we'll be looking at muscle tissue in general, including the cells that make up the skeletal muscles. Let's get to it though. So a muscle is involved in movement. It moves body parts, body part contents, breathing, circulation, digestion, also has roles in communication. It has a role in stability, helps us maintain posture. And as we talked about before, it helps stabilize the joints. It also controls body openings and passages. Muscles control food intake, elimination of waste, emission of light into the eye. And they are also important in heat production or thermogenesis. The skeletal muscles produce 20 to 30% of the body heat at rest and up to 85% of body heat when we are actively exercising. They are also involved in hormone secretion and glycemic control. Exercise muscles release hormones that stimulate glucose synthesis by the liver and breakdown of visceral fat. And the skeletal muscles absorb, store, and use the large share of the body's glucose and play an important role in stabilizing blood concentrations. The word muscle means little mouse. There are three kinds of muscles: skeletal, cardiac, and smooth. All three types specialize for one major purpose: convert chemical energy of ATP into the mechanical energy of motion, and that motion is always to contract. The muscular system refers to just skeletal muscles, and there are approximately 600 in the human body. If you study muscles, you are doing myology. Skeletal muscle contains muscular tissue, connective tissue, nerves, and blood vessels. So they are, in a sense, individual organs. The connective tissue components from the deeper regions to the more outer regions around each fiber, each cell, there is a connective tissue layer called endomysium. There is paramysium that groups together of endomysium into fascicles, and those fascicles are bundles of muscle fibers wrapped together. And then there is an epimysium around the entire outside, a fibrous sheath surrounding the entire muscle that blends with the fascia and deeper connective tissues. So we organize it with individual muscle fibers surrounded by epimysium. Those are found by those gather into groups covered by paramysium to make up a fascicle, and a number of fascicles will be covered with the epimysium. Just made a mistake there. Individual fibers are endomysium. They group into fascicles with paramysium, and then the fascicles are grouped together as the organ with epimysium. Strength of a muscle and direction of its pull are determined partly by the orientation of its fascicles. We can have a fusiform muscle, a parallel muscle, or a triangular or convergent muscles. In the fusiform muscles, we have thick in the middle with the fascicles converging on the tapered ends. Parallel, they are uniform width with parallel fascicles, and then the convergent ones are broad at one end, converging in another narrower end. We can also have pennate muscles, which are kind of feathered shaped. The fascicles attach obliquely on a tendon that runs the length of the muscle, and those could be unipennate if they're only on one side, bipennate if they're on both sides, or multipennate if there are bunches of these feathers converging to a single point. We can have circular muscles known as sphincters. Their fascicles will form rings around a body opening and passage. When they contract, constriction, the opening, when they contract, they constrict the opening and prevent the passage of materials through them. Here are those particular forms with examples of each one. Fascicles package groups of functionally related muscles into muscle compartments. A compartment also contains nerves and blood vessels that supply the muscle group. Some of the fascia between compartments are extra thick. They are known as intramuscular septa. We can see that the muscle is grouped into compartments. Muscles have a direct or indirect attachment to the bone. A direct fleshy attachment to the bone, there's little separation between the muscle and bone. Indirect attachment to the bone, we get a fibrous cord called a tendon connecting the muscle to the bone. Collagen fibers of the endo, peri, and epimysium continue into the tendon and from there into the periosteum and the matrix of the bone. An aponeurosis is a similar structure, but it's a broad, flat sheet, and a retinaculum is a connective tissue band that tendons form from a separate muscle pass under. Attachments used to be called origin and insertion. That's not very accurate. That's still the one that I was trained with and I'm kind of stuck to. The origin is the stationary end. The insertion is the moving end. Some anatomists prefer non-traditional descriptions of attachment by proximal versus distal or superior versus inferior. Most skeletal muscles connect to the bone, but there are some that attach to the dermis, the fascia, or other soft connective tissues. Those are mostly in the face. Some muscles are intrinsic or extrinsic to the organ they control. An intrinsic muscle is entirely contained within a region. The intrinsic muscles of the hand are contained entirely within the hand. Extrinsic muscles act on a designated region but arise from another region. So we also have extrinsic hand muscles that arise in the forearm. There are additional intrinsic, extrinsic muscle examples in the tongue, the larynx, the back, the foot, and other regions. Muscles perform an action, an effect produced by a muscle to produce a movement. They usually act in groups. There are 4 major categories of muscle action. A prime mover is the muscle that produces most of the force of the movement. A synergist is a muscle that aids that prime mover. An antagonist is a muscle that opposes the prime mover. And a fixator is a muscle that helps prevent the bone from moving during a particular movement. It's important to remember that when you have a movement, you have often a prime mover, a synergist, an antagonist, and a fixator. The opposite movement, so if you were talking about flexion, you would have a prime mover. The opposite movement, that prime mover is probably the antagonist for extension, for example. Innervation of a muscle refers to the identity of the nerves that stimulate it. Knowing innervation enables the diagnosis of nerve, spinal cord, and brainstem injuries from muscle tests. Muscles are innervated by nerve branches from the spinal and cranial nerves. The spinal nerves arise from the spinal cord, come through the intervertebral foramen, immediately branch into the posterior and anterior rami, and innervate muscles below the neck. The cranial nerves arise from the base of the brain, emerge through the skull foramina, and innervate the muscles of the head and neck. They are numbered CN1 through CN12. Blood supply of the muscular system, we get about 1.25 liters of blood per minute at rest. During heavy exercise, total cardiac output rises and the muscular system's share can be more than 3/4. Capillaries branch extensively through the endomysium to reach each individual muscle fiber. Naming of the muscles are generally based on Latin words, but they are very distinctive as far as the structure, location, and action. Once you figure out these Latin terms, you will see that the name of that muscle is very, very descriptive. The depressor labii inferioris is depresses the bottom inferior of the lip, labium. The flexor digitalis Flexor digiti minimi brevis is a short muscle that flexes the smallest finger. So they are very descriptive once you get a handle on the language. When you are learning about the muscular system, this lecture is not going to cover everything you need. You should be examining models. We likely don't have cadavers available or dissected animals, but we do have photographic atlases, and the internet is always a good place to look for them. A good way to remember them is to palpate the muscles on yourself when you are learning about a particular muscle. You can locate attachments of muscles on articulated skeletons. You can study the derivation of each muscle name. Again, it usually describes a muscle's location, appearance, attachments, or actions. And say the names aloud to yourself or a study partner, and do your best to spell them correctly. This won't be the pot calling the kettle black, though. So there are, as I said, about 600 muscles. I'm not going to walk you through each one of them. This is the anterior view, close up, posterior view, again, close up. But I am going to go through a few groups of muscles that may be particularly useful to you. So we have muscles of facial expression. These attach to the dermis and the subcutaneous tissues that tense the skin and produce facial expressions. They're innervated by facial nerve 7, and they're found in the scalp, forehead, around the eyes, nose, mouth, and in the neck. In the scalp, we have the occipital frontalis muscle, which has a frontal belly and occipital belly, and they are connected by an aponeurosis called the Galea aponeurotica. The orbital and nasal regions, we have the orbicularis oculi, which is the sphincter of the eyelid, encircles and closes the eye. The levator palabrae superioris opens the eye deep to the orbicularis oculi, and it elevates the upper lid. The orbicular oris is a complex of muscles in the lips, encircling the mouth, with 4 interlacing muscle quadrants, which are used to pucker the lips. There are several muscles in the lower face that converge on the modiolus, a complex cord just lateral to each angle of the lips. In the chin and cheek, the mental and buccal regions, we have the mentalis muscle, which extends from the upper margin of the mandible to the skin of the chin. Some people have a mental cleft or dimple between them. It elevates and protrudes the lower lip. The buccinator is the muscle of the cheek. It compresses the cheek. And the platysma is a thin superficial muscle on the upper chest and lower face involved in facial expression. The tongue is used to push food between the molars for chewing, mastication, forces food into the pharynx for swallowing, deglution, and it is crucially important for speech. There are intrinsic and extrinsic muscles. The intrinsic muscles are entirely within the tongue. They are the vertical, transverse, and longitudinal fascicles, while the extrinsic muscles arise from outside the tongue. The muscles for chewing involve 4 pairs, the temporalis, the masseter, and 2 pairs of the pterygoid muscles. Chewing is depressing to open the mouth, elevating for biting, protraction so incisors can cut, retraction to make the rear teeth meet, lateral and medial extrusion to grind the food. There are 8 pairs of hyoid muscles associated with the hyoid bone that are involved in chewing, swallowing, and speaking. The 4 of them are in the suprahyoid group. They are above the hyoid, the digastric, the geniohyoid, the mylohyoid, and the stylohyoid. The infrahyoid muscles are below the hyoid, and they fix the hyoid bone from below and allow the suprahyoid muscles to open the mouth. They would be the omohyoid, the thyrohyoid, the sternohyoid, and the sternothyroid. Pharyngeal muscles are three pairs of pharyngeal constrictors that form a muscular funnel, and during swallowing, they drive the food into the esophagus. Attachments arise from the vertebral column, thoracic cage in the pectoral girdle, and end on the cranial bones. Their actions are flexion, extension, lateral flexion, rotation, and depending on the attachments, they can cause contralateral towards the opposite side or ipsilateral toward the same side. These are where the head and neck muscles are attached. Flexors of the neck include the sternocleidoid mastoid, which is the prime mover of neck flexion. The scalenes are three muscles on each side of the neck. They cause unilateral contract. If they are unilaterally contracted, you get ipsilateral flexion and contralateral rotation. If they are bilaterally contracted, you cause flexion of the neck. Extensors of the neck would be the trapezius, the splenus capitis, and the splenus cervicis, the semispinalis, the capitis, and the semispinalis cervicis. For respiration, breathing is going to require us to use muscles enclosing the thoracic cavity, the diaphragm, and the muscles between the ribs. The diaphragm is a muscular dome between the thoracic and abdominal cavities. Its fibers converge toward a central tendon. Contraction causes the diaphragm to flatten, which in turn enlarges the volume of the thoracic cavity, and that causes air to come in. Between the ribs, we have external intercostal muscles, which elevate the ribs, internal intercostal muscles, which are deep to those, and each one is divided into intercartilaginous and interosseous parts. They're used to depress the rib. And innermost intercostal muscles vary in number. They have the same function as the internal intercostals. In the abdominal wall, there are three layers of muscles extend halfway across the anterior abdomen: the external oblique muscle, the internal oblique muscle, and the transverse abdominal muscle, also called the transversus abdominis. All of these abdominal muscles support the viscera, stabilize the spine, and compress the abdominal contents. Also in the abdomen, we have the rectus abdominis muscles, which are paired muscles extending vertically from the sternum to the pubis, and they flex the waist. Tendons of the oblique and transverse muscles are broad fibrous sheets called aponeuroses. We saw one, we've seen those before, one in the head. In the back, the actions generally involve extension, rotation, and lateral flexion of the vertebral column. We have the latissimus dorsi and trapezius, the prominent superficial back muscles. The serratus posterior, superior, and inferior, they extend from the vertebrae to the ribs and aid in deep breathing. The erector spinae are deep to the serratus posterior muscles and run vertically from the cranium to the sacrum, consist of three parts, paired on each side: the iliocostus, the longissimus, and the spinalis. Deep muscles in the back include the semispinalis thoracis, the quadratus lumborum. The thoracolumnar fascia encloses the erector spinae and quadratus lumborum, and the multifidus is a collective name for a series of thin muscles connecting adjacent vertebrae to each other, stabilizing the vertebrae and used for maintaining posture. In the pelvic cavity, we have a strong multi-layered muscular sheet making up the floor. The perineum is a diamond-shaped region between the thighs. It's bordered by four landmarks: the pubic symphysis, the coccyx, and the ischial tuberosities. There is the anal triangle, which is the posterior half of the perineum, and the urogenital triangle, which is the anterior half of the perineum. The superficial perineal space contains three pairs of muscle: the ischiocavernosus, which converges like a V to form toward the ischial tuberosities, the bulbospinogenesis, also called the bulbocavernosus, forms a sheath around the root of the penis in males and encloses the vagina in females. And the superficial transverse perineal muscles extend from the ischial tuberosities to the medium fibromuscular perineal body in a scene called the perineal raphe. Deep perineal muscles include the deep transverse perineal muscle, the compressor urethrae. The anal triangle contains the external anal sphincter and the anococcygeal ligament, and the pelvic diaphragm is composed mainly of the levator ani muscles. A hernia is a condition in which the viscera protrudes through a weak point in the muscular walls of the abdominal pelvic cavity. There are a number of different types of hernias. An inguinal hernia is the most common type of hernia, although it is rare in women. The viscera enter the inguinal canal or even the scrotum. A hiatal hernia is the stomach protrudes through the diaphragm into the thorax. That can happen to many overweight people, especially if they are over age 40. In an umbilical hernia, the viscera protrude through the navel. Upper limb. Upper limb is used for a broad range of actions: climbing, grasping, throwing, writing, playing musical instruments, manipulating small objects. There are some functional groups. We'll look at muscles that act on the scapula, muscles that act on the humerus and shoulder joint, muscles that act on the forearm and elbow joint, muscles that act on the wrist, hand, and fingers. Muscles acting on the pectoral girdle extend from the axial skeleton to the clavicle and scapula. The scapula loosely attached to the thoracic cage, capable of great movement, rotation, elevation, depression, protraction, retraction. Remember, the clavicles brace the shoulder and moderates movements. So in the pectoral girdle, and we have the anterior and posterior groups. The anterior group is the pectoralis minor and the serratus anterior. The posterior group, we have the trapezius, a large superficial muscle causing elevation, depression, and retraction of the scapula. The levator scapulae, the rhomboid major and minor. There are 9 muscles that cross the shoulder joint and attach to the humerus. 7 are scapular muscles, and 2 are axial muscles. They come from the scapula or the axial skeleton. Rotator cuff muscles are a group of tendons of 4 scapular muscles that form, the acronym is the situs muscles, the sits muscles, supraspinatus, infraspinatus, teres minor, and subscapularis. The tendons merge with the joint capsule of the shoulder, and they cross it and root to the humerus. That helps to hold the head of the humerus into the glenoid cavity. It is the supraspinatus tendon that is most easily damaged. Other scapular muscles include the deltoid, which is a triangular shape, teres major, and coracobrachialis. In the axial muscles, we have the pectoralis major and the latissimus dorsi. Now, if we look at the arm and elbow, there we can get flexion, extension, pronation, and supination. The elbow flexors are in the anterior compartment. They include the brachialis and the biceps brachii. The elbow extensors are in the posterior compartment, and they include the triceps brachii. In the antebrachial region, we have the brachioradialis, the aconius, the pronator quadris, the pronator teres, and the supinator. Intrinsic muscles in the hand itself include muscles that do flexion and extension of the wrist and digits, the radial and the ulnar flexion, finger abduction and adduction, and thumb opposition. The fascia divide the forearm muscles into anterior and posterior compartments, each with superficial and deep layers. In the anterior compartment, we have flexor carpi radialis, flexor carpi ulnaris, flexor digitorum superficialis, and polymeris longus. In the anterior compartment, deep layer, we have the flexor digitorum profundus and the flexor pollicis longus. Pollicis refers to the thumb. In the posterior compartment, the superficial layer has the extensor carpi radialis longus, the extensor carpi radialis brevis, the extensor digitorum, the extensor digiti minimi, and the extensor carpi ulnaris. In the deep layer, we have the abductor pollis longus, the extensor pollis brevis, the extensor pollis longus, and the extensor indicis. Carpal tunnel syndrome, we have in the wrist area a structure called the flexor reticulaculum, which is a bracelet-like fibrous sheet that's passed under by the flexor tendons crossing the wrist. The carpal tunnel is the tight space between the flexor reticulaculum and the carpal bones. And as the flexor tendons are passing through the tunnel, they are enclosed by tendon sheets. That enables the tendons to slide back and forth quite easily when it's working correctly. In carpal tunnel syndrome, which can be caused by prolonged repetitive motions of wrists and fingers, the tissues in the carpal tunnel become inflamed, swollen, or even fibrotic. That puts pressure on the median nerve of the wrist that passes through the carpal tunnel along with the flexor tendons. You end up with tingling and muscle weakness in the palm and medial side of the hand. Pain may radiate from the arm to the shoulder. It can be treated with anti-inflammatory drugs, immobilization of the wrist, and sometimes surgery to remove part or all of the flexor reticulaculum. In the hand, we have intrinsic muscles that move that assist the muscles of the forearm in moving the fingers in more precision. There's the thenar group, the abductor pollicis, the abductor pollicis brevis, the flexor pollicis brevis, and the opponens pollicis. The hypothenar group, we have the abductor digiti minimi, the flexor digiti minimi brevis, and the opponens digiti minimi. In the mid-palmar group, we have 11 muscles divided into 3 groups: 4 dorsal interosseous muscles, 3 palmar interosseous muscles, and 4 lumbrical muscles. In the lower part of the body, we have the largest muscles. They are less about precision, more about strength needed for standing, maintaining balance, walking, and running. Several of these muscles will cross and act on 2 or more joints. Remember, the leg is the part of the limb between the knee and the ankle, and the foot includes the tarsal region, the ankle, the metatarsals, and the toes. In the anterior muscles of the hip, we have the iliopsoas, which flexes the thigh at the hip. It's a collective term for 2 muscles that share a common tendon, the iliacus and the psoas major. In the lateral and posterior, we have the tensor fasciae latae, the gluteus maximus, the gluteus minimus, and the gluteus medius. The adductor compartment of the thigh, the muscles are the adductor brevis, adductor longus, adductor magnus, the gracilis, and the pectineus. Lateral rotators include the gemellus superior, gemellus inferior, obturator externus, obturator internus, piriformis, then the quadratus femoris. In the anterior compartment, we have extensors, the quadriceps femoris, the sartorius. In the posterior, we have flexor muscles. The hamstring group includes the biceps femoris, the semitendinous, and the semimembranous. Also, extensors are the fibularis terratus, the extensor digitorum longus, the extensor hallucis longus, the tibialis anterior, and they're muscles of the tendons held against the ankle by two external reticulacula. The flexor compartment, we have the gastrocnemius, the soleus, and the plantaris. The triceps surae is a collective name for the gastrocnemius and the soleus. It attaches to the calcaneus via the calcaneal tendon, which is typically referred to as the Achilles tendon, the strongest tendon in the body. The deep group includes the flexor digitorum longus, the flexor hallucis longus, and the tibialis posterior. The lateral compartment has the fibularis brevis and the fibularis longus, providing lift and forward thrust during walking. In the superior aspect of the foot, we have the extensor digitorum brevis. In the ventral aspect, flexor digitorum brevis, abductor digiti minimi, abductor hallucis. And in the second layer, we have the quadratus plantae and the lumbrical muscles. The third layer contains the flexor digitorum minimi brevis, the flexor hallucis brevis, and the adductor hallucis. Hallucis refers to the great toe, as pollis referred to the thumb. In the ventral fourth layer, the deepest layer, we have 4 dorsal interosseous muscles and 3 plantar interosseous muscles. And that concludes our overview of the the muscular system. Next week, we'll talk about muscle tissue.